Good morning, everyone. It is 3 a.m. I can't sleep. Last few nights have been really, really rough. The night before this one was, I think, my roughest to date, at least for this pregnancy. For those of you who are new to the channel, I have pregnancy-related RLS, which means I'm having, as the pregnancy is progressing, increasing difficulty sleeping. And so I'm recording that because last time I had pregnancy related RLS, it got wild. And so I wanted to record it like, hey, this is an interesting thing that happened in pregnancy. I do feel mildly regretful because as I was setting up for this video, I've been making a very concentrated effort to dress a lot prettier. I've been wearing, believe it or no, I mean, this is me, and you guys have seen me like dressing like I've got my pajamas on underneath my sweater here. I have been wearing floral dresses consistently for the last few weeks, actually, several weeks. Floral dresses, big colorful dangly earrings. I've been wearing those a lot. Just almost daily I've been wearing these things. I've been doing my hair up nicely. The reason for that is kind of twofold. On the one hand, I told myself I wasn't going to cut a mohawk in my hair, but I like having a mohawk, and so what was happening was I was growing my hair out because I figured my husband would want longer hair, which he does. He wants me to have long hair. And I was growing my hair out, and I was in this awkward between phase, and I kind of... Is that a cat? Yes. I was in this awkward between phase, and I hated it, so I just wasn't doing anything with my hair, so my hair was messy all the time, and I hated that too. Finally, I looked at it, was like, okay, I need to do something about this. I cut the mohawk back into my hair, and I was like, okay, as a form of compromise, because I don't want to be... I know my husband isn't fond of the mohawk. I'm going to make sure to wear pretty dresses. I'm going to make sure to kind of dress nicely and take care of the hair, which was a lot easier because I liked it, so then I wanted to play around with it and style it. Anyway, so I've been looking so much nicer during the day. Like, I'm still fat because I'm pregnant, but I've been looking a lot nicer. And it's been pretty, decently consistent for the last several weeks. And it's like, I'm kind of proud of myself. It's like, well, okay, I've never been a dress person, but I'm pregnant, so none of my pants fit. So this is a great time to kind of transition over into the habit of wearing dresses. And so I've been doing that. It's been cool. Are you guys going to see that in a video anytime soon? Well, I did film one video during the day, but I haven't had a chance to edit it. And right now, it's 3 a.m. I haven't been able to sleep for the last few nights. Am I going to take the time to dress up all pretty for YouTube? No, I'm not going to dress up pretty for YouTube. I'm sorry, guys. Like, it's not happening. I'm not going to dress up pretty for you. I'm so sorry. It's 3 a.m. I can't sleep. I figure it's a win if I can just wake up enough to string 2 sentences together. It's like, yay, I don't sound like I'm drunk. That's really cool. So here we are. I wanted to talk about this thing that I've been hearing a lot, and it's something in the trans debate. It's about, letting people transition, and I just wanted to give a personal story that I think adds a little bit of perspective in that debate. And, I've heard this, like, I've heard people in right-wing circles even talking about this, and it seems like a really, really reasonable thought. However, there are some serious concerns that I think kind of people don't necessarily realize some of these issues until they really take a look under the surface on them. And so I figured, again, I'd share a personal story to kind of flesh out this particular issue with the trans debate, just to give people a little perspective. I'm not saying there's one right way to handle this issue. I've been noticing more and more people saying this, and it seems reasonable, and I think we need to take a closer look at that. So when it comes to people transitioning, a lot of people, please don't do that. You're going to do that anyway. There's a cat. Yep. Oh, involuntary cat cameo. Hey, buddy. Say hi to YouTube. Yeah, okay. I'm gonna let you go that way. Can you go that way? Good job. Now, what was I talking about? I do see a lot of people from all ends of the argument saying, I don't care what a person does if they're an adult. I don't care what a person does to themselves medically if they're an adult. But we cannot allow children and people under 18 to transition medically. A lot of people then say, well, if you're an adult, if you're over 18, you're an adult. You do what you want. That's the other side of that argument. Under 18, too dangerous, too many complications. Over 18, you're an adult. You want to screw your life up? You screw your life up. It's a free country, right? Here's the problem with that. And here's why I wanted to share a personal story to kind of give you guys a little bit of perspective, a little bit of context. Transitioning has always been a treatment for a psychological condition, which is gender dysphoria. And gender dysphoria is, the way it's always been viewed was a clinically significant disturbance in a person's life where it was interfering with their ability to cope and function on a day-to-day basis. And if they were so mentally distressed that they couldn't cope on a day-to-day basis because of their gender dysphoria, at that point the treatment was, let's medically transition them to the other gender. That's how psychological medicine is supposed to work. It is only clinically significant and diagnosable if it is interfering with your ability to function. Now, I'm an autoandrophile, which means I am, a woman who's sexually aroused at the idea of being a man. Now, there's more to it than that. I'm also very fond of the idea of being a man, and I feel happier at the idea of being a man, and so it hits me on multiple levels. But the way the term was originally coined was by a sexologist, so of course his focus was on the sexual aspect of it. Would I just be happy being a man? And many autoandrophiles probably would. They'd be happy being a man.
Just a quick but important note, just because a person feels like they would be happy as the opposite sex, that doesn't guarantee that they actually would be happy as the opposite sex. And this goes double for transitioning to the opposite sex, which, at least for me, as actually being the opposite sex.
And so, and the same thing goes for the opposite, which is an autogynephile, a biological male who wants to be a female, becomes sexually aroused at the idea of being a female, but also probably would just be happy as a female. Why can't people just be happy? That's not a clinically significant problem. At that point, you're just trying to improve the quality of your life and make yourself happier. The trans debate is complicated because we don't have clear definitions of things. And so immediately then you end up on this rabbit hole that takes you way off in the other direction. Like, well, can't people just make decisions that make them happy? That's a good question. We could talk about that for hours. That's not what we're talking about today, at least not in this video. So ignoring the I want to transition because it's going to make me feel good, it's going to give me that gender euphoria, which I might be willing to transition to get enough of that gender euphoria. Ignoring that section of the trans population and going over to the other sections of the trans population, many of which are transitioning to escape gender dysphoria. Here's the problem. Those individuals are trying to escape something. They're not trying to just improve the quality of their life or improve their personal aesthetics or make themselves just feel good, just feel nice. These people are trying to treat a mental disorder. They are unhappy and they are trying to ease their own distress, at which point it stops being, hey, I'm doing this because it makes me feel good and it's aesthetically pleasing, which is kind of the angle that I would be approaching it from because I don't experience significant dysphoria. I also don't want to transition, but that's a different matter. These people are coming at it and saying, I am dysphoric. I am struggling with a lot of mental distress and mental illness, and I want to feel better. And I think transition will help with that. And it becomes a medical treatment. You're doing the transition because you feel like it will alleviate negative symptoms. And I mean, that should be duh. That should be a very, very duh statement. You're kind of sitting here wondering, okay, I've watched this video for this long. She's finally said this. Is that really the point that she's been getting to this whole time? I think it's important to spell that out, because in order to add the next layer onto this cake here, we kind of do need to spell that out. Because then it's not a question of, well, you're an adult, you should be able to do what you want. It's a matter of, you are a patient seeking treatment for a disorder. Are you receiving the correct treatment for the disorder that you are experiencing? At that point, it's not, well, I should just be able to do to my body whatever I want. It's, okay, you need to go through proper channels. You need to talk to a mental health specialist. You need to talk to doctors. You are doing something that is going to have health effects on your body for the rest of your life. You need to really weigh the pros and the cons, and you need to be presented with as clear a picture as possible of what those pros and cons are going to be. This is no longer an aesthetic choice. This is a medical one. People cannot prescribe themselves their own medications. We understand this, but even then, I see a lot of people who are like, well, again, they're adults. They want to do it. Just let them do it. And I wanted to share with you guys the story about how I got misdiagnosed with bipolar disorder. So for those of you who are familiar with my channel, I've talked about this a lot because it happened very recently and it kind of was very disruptive to my life. For those of you who are new to my channel, I spent about 2 years being very mentally ill. It wasn't fun. I'm really happy that it's over. I even today, like, I was just looking at my life and my family and my husband, and I was like, I'm happy. I didn't think I'd ever experience happiness again. Like, I was like, okay, I think this is the end of me being happy, like, ever again. And I was kind of frightened because I was like, I don't know where this is going. And I sought therapy, and my therapist was like, oh, you have bipolar disorder. And when she first told me, I laughed right in her face. I just laughed in her face. I was like, you're joking, right? She's like, no, I've been a clinician for over 30 years, and I know bipolar disorder when I see it, and this is bipolar disorder. I research the living shit out of anything that catches my interest. If it's shiny, I'm gonna read about it, and I'm gonna read everything about it, because that's just what I do. So in the time since that initial conversation, I've done a lot of research, and I found that a lot of clinicians feel like they have to really work to convince their patients that they have bipolar disorder, because a lot of patients just don't believe them. And the reason is because of the way bipolar symptoms manifest. The patient has a manic episode or a depressive episode, and it's really bad, but then they climb out of it and they go back to baseline for a while. And when the clinician looks at their baseline and says, hey, you have bipolar disorder, the patient's at baseline at that point. They're like, no, I don't. Like, what are you talking about? And it's not until they've had a few different manic episodes or a few different depressive episodes, and they've gone through that yo-yoing back and forth, and then going back to normal, and then yo-yoing again, and then back to normal. And it, then it starts to become a little clearer when they start to see the pattern themselves. But initially, it's like, hell no, I don't have bipolar disorder. Now, usually bipolar disorder is diagnosed in people who are in their early 20s, because the symptoms start to manifest as you enter into your late teens, early 20s. It's like a lot of people, they go to college, and then all of a sudden they start having these crazy mood issues, and it's like, oh wow, I'm sorry to tell you this, but now you're bipolar. And it sucks for them, because then they have to readjust to this new issue that they have that just kind of hit them out of nowhere. I think schizophrenia tends to work the same way. It's like you're fine as a kid, but then when you hit adulthood, all of a sudden it's kind of like, oh, yeah, your life is going to be more complicated. I'm so sorry. I'm 36. Like at the time, I think it was about 34, 35, something like that. When she told me this, I think it was 34. And I was like, okay, if I have bipolar disorder, where the fuck has it been hiding for the last decade? Like, I think that's a reasonable question. And so, I didn't believe her. And I brought in a copy of the DSM, the Diagnostic and Statistical Manual, which is used to diagnose a lot of these mental conditions. I brought in a copy of the DSM diagnostic criteria for bipolar disorder. And I started going through the list of diagnostic criteria with my therapist in one of my therapy sessions. Like, I have never exhibited the symptoms of bipolar disorder, so why are you telling me I have it? And she kept insisting that I had it. And she was looking at things like, I have ADHD, and so I tend to be high energy. Plus, I was struggling with a depression. Now, my depression wasn't my only problem, but it was one of the major issues that I was facing. It was the big scary problem that I was struggling with. There were some other problems that she didn't recognize or diagnose correctly, which, again, how many hours and how many thousands of dollars did I waste when, after visiting her for as long as I did, I went to my general practitioner. I was like, look, something's wrong with me. I don't want to live anymore. I don't have bipolar disorder. I'm very certain of that. And I don't seem to have a thyroid disorder because we've already come in and asked you to test me for that. But I have some sort of problem. Here are my symptoms. And I was halfway done listing my symptoms, and he stopped me and said, oh, I know what you have. You have this. Here's a pill for it. It will go away. I was like, within a week or two, he'd solved my problem. It was just like, I was crazy for 2 years, and I just needed a little teeny pill for a couple weeks, and it was like, boom, hello, welcome to the road to normal again. And so, yeah, that was frustrating. Like, she didn't see that, but in her 30 years of professional experience, she totally saw bipolar disorder. So anyway, why am I telling you guys all this? Well, because I believed her. After bringing in a copy of the DSM and going over the criteria and having her look at it and saying, well, you are very rapid fire in your speech. Well, you are very energetic sometimes when you come in, and it depended on how depressed I was that day, because the depression never went away. It was an overall thing that happened for like a 2-year block of time. It really sucked. But, I was always trying to really push past it and really throw myself into life and really climb out of that depression. And I was putting so much energy into that. So outwardly, yeah, it looked like I was having days where I was really high energy and days when I was really low energy. And if we're meeting every couple of weeks, she's sitting there thinking, okay, this is your up down. And I'm telling her that I'm not having the classic up down symptoms of bipolar disorder. I'm telling her that my husband, who lives with me on a day-to-day basis and observes me more than most people, is also not observing this. And she's looking and saying, no, I know bipolar disorder. I know bipolar disorder when I see it. She was looking at my lifestyle choices, which are unorthodox, and saying, okay, these are all symptoms of bipolar disorder. The reason you became a stripper was because you were having a bipolar episode. It's like, no, the reason I became a stripper is because I planned it for months and months. And as soon as I was 21, that's what I did, because I needed to improve the quality of my life, and I didn't have any other options left. But I don't think she was listening to me. Like, she wasn't looking at the circumstances around the decisions I made. She was just looking at the decisions I made and saying, yep, that's bipolar disorder. I know it when I see it. 30 years of clinical experience, blah, 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 blah. And so I believed her. I was desperate. I was mentally ill. And I don't think people realize, I was willing to completely ignore my own understanding of my own psychology, which was a bad decision on my part. But I was willing to completely ignore the fact that I had a copy of the DSM diagnostic criteria in my hands, and I was going through the entire diagnostic criteria, and I didn't have any of the symptoms of this disorder. I have never in my life actually exhibited any of the symptoms of bipolar disorder, but I was willing to ignore all of that because I was very mentally ill and I didn't know what else to do. And I had a professional who was supposed to know what the fuck she was talking about telling me, oh no, I know what this is. And so I ignored my own intuition. I ignored my own research. I ignored the people around me who were lay people who were like, yeah, you've never had a manic episode that we've ever seen. And I looked at it and said, okay, somehow I must have this bipolar disorder. And I like to think that I'm a logical individual and a rational individual and a relatively, intelligent enough individual. Dude, I was so mentally ill, and I had been so mentally ill for a long time. Depression is no laughing matter. I was suicidal. I had other problems that I haven't talked about in any of my videos, and I think I'm finally getting to the place in my own life where I feel like I can talk about it, but that's a whole long video on its own. I had other mental health issues. Like, I was a train wreck. And I was so desperate for anything that could help me get better that I was willing to put aside logic. I was willing to put aside reason. I was willing to put aside everything and, just trust the professional. Let's try this out. And so I started treating my bipolar disorder that I didn't actually have. Now, luckily, I didn't do any of the medications because if you have bipolar disorder, some of those medications can be amazing. They can be a godsend. But if you don't have bipolar disorder, those medications will turn you into a zombie. And I'm really happy that I didn't end up drooling all over myself, because I think that would have made things worse. I was already depressed enough. And I can imagine they just pumped me full of meds, psych meds, and turned me into, a drooling zombie, because I don't have bipolar disorder, so they wouldn't have made me feel any better. And, I think I could have royally fucked my life up even more than it was already fucked up. And I was already suicidal, so I can imagine that probably wouldn't have helped things either. So at least I didn't go the medical route. I tried to do non-medical treatments. So I was like, well, I'm bipolar, so I need to make sure I get exercise. I need to make sure I eat healthy. I need to make sure that I stick to a routine. I have ADHD. I suck at sticking to a routine. But all of a sudden it was like, well, maybe if I stick to a routine, I'll be more mentally healthy. I started keeping a mood journal because everybody talks about how mood journals are really important for bipolar disorder, so you can start to watch for fluctuations in your mood. So I'm writing everything down really studiously and carefully, and I'm trying to I got one of those apps that will tell you what your mood is, like, from day to day. Like, you can like put in a little like smiley face or frowny face, and they have like a color-coded chart for what your mood is, so that you can watch your moods go up and down over time. And that's something people do to help regulate bipolar disorder. So I was doing that. Basically, the more I charted my moods, the more I failed to exhibit any symptoms of bipolar disorder. So that kind of didn't help so much. The thing was, I clung to that belief that I had bipolar disorder. I tried to make it fit. I read everything I could on bipolar disorder, trying as hard as I could to make this diagnosis stick to me in any way. And to this day, my therapist still insists that I have bipolar disorder. By the way, she's not my therapist anymore, because fuck that shit. But she never budged on that. I know bipolar disorder when I see it. Yeah, all right, bitch. I'm not giving you any more money, am I? I tried so hard to make that work. Why is that story relevant? Because I know firsthand from that experience just how willing a person is to do anything, no matter how crazy it might seem, to feel better when they are mentally ill. So when a person says, I need to transition, they might not actually be transgender. Or, also a problem, they might be transgender, but they might not be suffering from gender dysphoria. Hear me out. When I was struggling with my mental illness, I was deeply unhappy with my body. So much so that I remember staring in the mirror and thinking, if I went to the kitchen and got a kitchen knife and started cutting pieces of myself off with a kitchen knife, would that help me feel better? Was that gender dysphoria or was that body dysmorphia? Really hard to tell those two things apart. If you don't really take much time to really dig into it and study it too much and really think about it, it looks exactly the same. But those were mental issues that came about as a result of a mental illness that I was struggling with. We resolved the mental illness. I didn't want to take a kitchen knife to myself anymore. All of a sudden, I was okay living inside this body. I was severely depressed. I was struggling with some mental health issues. At the time, there was a lot going on in here that could look very easily like severe gender dysphoria. And I was depressed too. If you've got severe gender dysphoria, that can be depressing. So it's very easy to look at it and say, especially if a person comes into a clinic and says, hey, I think I'm trans. It's very easy for a less than careful, less than thorough, or less than really well experienced clinician, any one of those three things or all of the above, to look at it and say, oh, okay, you have gender dysphoria. Let's help you transition medically. That will make you feel better. The problem is, at that point, the patient coming into the clinic, they are mentally ill. They are struggling with a mental illness. And I don't think the average layperson necessarily understands how incredibly desperate a mentally ill person is to get themselves better. Because I was willing to throw away reality in a handbasket to get myself better. I was willing to completely ignore, everything that I knew to be true, my experiences, the experiences of people who were closest to me, who knew me well, the diagnostic criteria, all of it. I was willing to ignore all of that just to make myself get better. And I latched on to the first thing that looked like it would help me. The first thing that looked like a solution. You have bipolar disorder. Great, I have bipolar disorder. I'm obviously losing my mind, so sure, we'll call it bipolar disorder. What do I do to get better? When people say, an adult should be free to make these choices, yeah, I should be free, I as an individual who is currently, thank God, of good and sound mental health. I know people tend to look at it and say, well, once you're mentally ill, you're mentally ill. No, I went into depression because of life circumstances, and I developed other mental health problems because of life circumstances. My husband had a brain tumor. We fixed my husband's brain tumor, then we fixed my mental health, and now I'm good to go, folks. I'm okay. I'm happy. I am no longer mentally ill. This is something I'm not sure people entirely understand. Just because you fall into a depression, that depression isn't a fixed state for the rest of your life. But, you know, if I, as a mentally healthy person, and even if I was going through depression, whatever, I don't think I'd want to make any really extreme decisions while I was depressed, because again, it makes me, I can see, particularly after this 2-year period, just how kind of warped I was mentally as a result of that depression. So it's like, do I really want to do anything? Do I really want to make any big decisions while I'm struggling with a severe depression? No, not a great time to make big decisions. But if I want to go into a plastic surgeon and say, hey, I don't like my boobs, can we do some shaping and sculpting and, some aesthetic changes to make it look good? If I want to do that, and honestly, that's not what a lot of people would call transition. I'm not changing my pronouns. I'm not asking people to call me he, him. I'm not changing my wardrobe over to a masculine wardrobe. I'm not doing any of that stuff. I'm just talking about like surgically, on the medical end of things. If I want to do that as an aesthetic choice, I should have the freedom as an adult to do that. But I'm doing that as an aesthetic choice. This is something I think will make me feel prettier, because I want to feel prettier or more handsome, whichever. It's not the same thing as going into a clinic or even to a plastic surgeon and being like, look, I'm struggling. I think I have gender dysphoria. I'm not well. I'm struggling with a lot of anxiety. I'm struggling with a lot of depression. I'm having suicidal thoughts. Chop my tits off, because I think it might make me feel better. At that point, it's a treatment. At that point, you're desperate to feel better, especially if you're dealing with suicidal ideation. At that point, it's like, come on. Literally, my life is in danger. Please save me. I don't want to feel like this anymore because I can't handle it. I actually wrote a blog post about suicide and about how, if a person is desperate enough to commit suicide, that means the circumstances in their life are so unbearable that they would do anything to get out of it, including killing themselves. That's anything. If you're sitting there wondering, well, what is anything? Killing yourself. If you are that desperate, you would do anything. So at that point, chop my boobs off. Sterilize me. Cut off my balls. I don't care. I need to feel better. I can't live like this. I will do anything. At that point, getting castrated doesn't sound like such a bad idea in comparison to suicide. At that point, you do anything. I don't think people understand how desperate some of these people are when they're trying to transition. And so I think we need to be far more careful about where we're handing out a lot of these medical, hormones, procedures, things like that. Because I think there is not all of the trans population. Again, some people are like, I really want this because I think it's going to make me feel better, and I think it's going to make me happier with my overall whatever. And at that point, you are an adult. There's some really scary health complications that you need to be aware of, but maybe you're willing to make that change anyway. And if you want the freedom to make that change, then you should have the freedom to make that change. However, when it becomes a treatment for a mental illness, a clinically significant mental illness, which means it is interfering with your ability to function on a day-to-day basis in your life, at that point, it's a medicine. And I think we as a society, and the medical community in particular, needs to be far more careful about how we're handing this stuff out, because we're giving it away like candy, and we're saying, well, adults should be free to make their own choices. Are they making those choices because they're well informed and they're doing what they want with their lives, or are they making these choices because they're trying to escape something horrible and they're desperate? Because desperate people will do anything.